All right, Chapter 8. We are doing reproduction system. Unfortunately, if you're taking anatomy at the same time, this chapter is usually one of the last things that you study. So this book kind of does it interesting that they put urinary system and reproductive system all in the beginning, but just following the chapters of the book. So again, if you're taking anatomy at the same time, then you might think, well, why are you already in the reproductive system? If you're not taking anatomy, or if you're already taking it, that doesn't really matter. But so the introduction, sexual reproduction is the union of the nuclei of the ovum and the sperm cell. So ovum is the egg. Ovum and sperm cells are called gametes. Each gamete contains half the number of chromosomes of a normal body cell. Remember, you have 46 chromosomes, so you get 23 from mama and 23 from papa. Gametes are produced in the gonads, so female gonads are the ovaries and the male gonads are the testes. Now, fertilization is an ovum leaves the ovaries and travels through the fallopian tube, and it leaves the ovum leaves the ovaries every 28 days. Fertilization takes place if the sperm cells are present and unite with the ovum. The fertilized egg implants then divides into form a ball of cells called a zygote, and later an embryo, and then a fetus after 63 days. Okay. Now, organs of the female reproductive system: you have ovaries, you have the fallopian tubes, you have a uterus, you have a cul-de-sac, you have a vagina, the Bartholin glands, clitoris, and the perineum. So if you look at this, here's number one, the ovary. You have two of those. There's the fallopian tube. Now remember, there's no real direct connection between the ovary and the fimbria. So every once in a while, eggs can get lost in the peritoneal or the pelvic cavity. There's the uterus. This is where babies grow. You know, people say, oh, mommy has a baby in her stomach. No, your stomach's way up here. So the babies grow in the uterus. Here's the little cul-de-sac. It's also called the pouch of Douglas or the retro pouch. I mean, there's a few different words for it. There's the cervix. Okay. There's the pubic bone. Look at the size of the urethra. There's the urinary bladder again. So females have separate opening for the urinary system, the digestive system, and the reproductive system. Whereas males, they share a common opening between the urinary system and the reproductive system. Here's the clitoris. Here's the Bartholin glands and the perineum, anus, and rectum. The fertilized egg implants, then divides to form a ball of cells called a zygote. Organs of the female reproductive system: you have a uteri, you have a utero-ovarian ligaments, ovarian follicles, the ovum, the corpus luteum, fallopian tube, fimbria, uterus, endometrium, myometrium, uterine serosa, cervix, and the vagina. So if you look at this, here's the fundus, here's the corpus, here's the little fimbria, here's your ovaries. Again, you have two ovaries. Here's the corpus luteum. Here's the little ovum that gets expelled every 28 days. The fimbria, with this little ciliary projections, will bring it in to the fallopian tube and makes its way. Usually, if there's sperm present, they'll fertilize. Now, really, to get pregnant, it's usually just a 1 to 2 day window. So you must have sperm present to get pregnant. You would think with all these scenarios, it's no wonder people get pregnant in the first place. But if you're younger, they're just having sex more often. As you get older, you're not doing as much. That's why when you get older, you have more difficulty with getting pregnant. But when you're ready to have kids, and you make sure, you try to time it, but really you want to have sex maybe 1 to 2 days before ovulation, because the normal lifespan of sperm is 36 to 48 hours, but for eggs it's about 24 to 36 hours. Okay, so really you got to time it. You can buy ovulation kits and you can buy all those kits, or if you're regular, then you can time it as well. But really, when you're ready to have kids, you just gotta, unfortunately, just do it more often so that you increase your chances. Corpus, here's the uterus. Here's the endometrium that sloughs off every 28 days. Here's the myometrium. Okay, here's the cervix. And then there's the vagina. Anatomic structures of the breast. You have glandular tissue, fatty tissue, ducts, and sinuses. So if you look at the breast here, here's the lymph nodes. There's the pectoralis major, pectoralis minor. You have glandular tissue, ducts, and sinuses. Here's a rib and fatty tissue. So for breast augmentation, they'll usually put it behind the pectoralis major and minor so that it doesn't affect if you are going to get a mammogram or not, okay? Because they're looking for this tissue. If the silicone or saline is behind the pectoralis major or minor, it should not affect the mammogram, okay? Now your menstrual cycle is divided into 28 days. The first day 1 through day 5. Blood cells, endometrial cells, and glandular secretions discharge from the body. So menses usually last about 4 to 5 days. Day 6 through 12, estrogen aids in the repair of the endometrium. The ovum grows in the follicle. Day 13 and 14, the egg leaves and the ovary and passes through the fallopian tube. And day 15 through 28, the corpus luteum secretes progesterone. The uterus lining builds up. So again, the first menstrual cycle is called a menarche. And again, you don't have to memorize this. This is just a good introduction to the female reproductive system and menstruation. I'm just introducing to words, so when you hear it, you're like, okay, that's what that means. Oh, that's what an ovum is. That's what a fallopian tube is. That's what endometrium means, myometrium, right? So again, days 1 through 5, you have menstruation. 6 through 12, the endometrium starts to repair. Ovulation occurs about day 13 or day 14. So if you want to get pregnant, you should probably start practicing around day 10 and day 11. And then menstruation. After ovulation occurs, your chances of getting pregnant are slim to none. So those that practice the rhythm method from days 15 through 28, usually you're okay. But if you don't want to take the risk, then you still use protection. Okay, here's the estrogen levels and here's the progesterone levels. If you're on birth control, you have a steady state of progesterone and estrogen, so your body thinks you're pregnant, so you're not releasing any more eggs, obviously, so that's why you can't get pregnant. Again, this is more physiology, but it is still interesting to know. Let's say there is a sperm present, then you get pregnant. If fertilization occurs, the egg implants in the uterine endometrium, the placenta forms, attaches to the uterine wall. Amnion holds the fetus in the amniotic cavity. Nutrients, oxygen, and waste exchange between the fetus and the mother, and the placenta produces HCG, and that's the pregnancy test that they can test for. Again, implantation will occur here. If implantation occurs in the fallopian tube, you can get an ectopic pregnancy, which could be very, very serious. So here's the placenta, chorion, and amnion membranes. Here's the placenta, the umbilical cord, umbilical arteries, veins. Here's the uterus, amnion, amniotic cavity. So amniocentesis would be a collection of fluid, and try to do that here. It's a weird looking baby in here. They should have drawn that a little bit better. I don't know if that's a really proportionate size there. Alright, the corpus luteum secretes this monthly to build up the lining of the uterus, and that would be progesterone, which would be C. What does the placenta secrete during pregnancy? And that would be B, as in human chorionic gonadotropin, HCG. Pregnancy, progesterone maintains the placenta development. The uterus expands as the fetus grows. The normal delivery fetal position is the cephalic presentation, meaning the head first. If it's breech, it's going to be feet first, and they can either turn it or do what they can to deliver, or maybe do an emergency C-section. Which hormone does the placenta produce? That would be progesterone. What does a pregnancy test look for? You might want to know that. 3 phases of labor. You have dilation and thinning of the cervix, you have birth of the infant, and then you have delivery of the placenta. Again, I'm going very fast through this again because in anatomy and physiology we would take a whole day to go over this. This is just, again, introducing you to the terminology. So here's the cephalic presentation and then delivery of the placenta. The placenta is full of stem cells, so if you don't have any religious reason not to get rid of it, then you can donate it to the hospital and they can use those stem cells to help someone that needs it. The pituitary secretes follicle-stimulating hormone, which is FSH, and luteinizing hormones, which is LH. The pituitary stops producing FSH and luteinizing hormone during pregnancy, and then of course with oral contraceptives. Okay, so that is why you don't release an egg, because pregnancy. So oral contraceptives really tell your body that you're pregnant, and therefore will stop secreting FSH and LH, and that is why you don't get pregnant. Menopause is a gradual ending of the menstrual cycle. Normally begins between ages of 45 and 55. You have falling estrogen levels. Option, you can have estrogen replacement therapy, but there are some risks. So how does the IUD function to prevent pregnancy? You can find out. How does a diaphragm work to prevent pregnancy and risks? So there's a lot of things that you can consider. Again, you don't have to know all that. I'm just giving you some options to think about. Okay, now let's actually go into the vocabulary. Adnexia, uteri, amnion, areola. Okay, so adnexia, uteri means fallopian tubes, ovaries, and supporting ligaments. Amnion is the innermost membranous sac surrounding the developing fetus. Areola is the dark pigmented area surrounding the breast and the nipple. Now there's areolar connective tissue in your body too, so don't get that confused. Bartholin glands, cervix, and the chorion. Bartholin glands are small mucus-secreting excreting glands at the vaginal orifice, named for Caspar Bartholin, a Danish anatomist who described them in 1637. Okay. Cervix is the lower neck-like portion of the uterus, and the chorion is the outermost layer of the 2 membranes surrounding the embryo. Here's the clitoris, coitus, and corpus luteum. Clitoris, sensitive erectile tissue anterior to the opening of the female urethra, that is equivalent to the male penis. Coitus means sexual intercourse, copulation, so you've heard of coitus interruptus, that is the withdrawal technique, so coitus and interruptus. Corpus luteum, that's an empty ovarian follicle, secretes progesterone after release of the egg cell, means a yellow body. Cul-de-sac, embryo, and endometrium. Cul-de-sac is a region, lower abdomen, midway between the rectum and the uterus. Again, it can sometimes be called the pouch of Douglas, retrouterine pouch. There's a couple different meanings, or not meanings, but words you can use. The embryo stage in prenatal development from 2 to 8 weeks. Endometrium is the inner mucosal membrane lining of the uterus. Estrogen, fallopian tube, fertilization. Estrogen is a hormone produced by the ovaries that promotes female secondary sex characteristics. The fallopian tube is one of a pair of ducts through which the ovum travels to the uterus. Oviduct named for Gabriele Falloppia, an Italian anatomist. And fertilization occurs in the distal third of the fallopian tube when the union of the sperm cell and the ovum from which the embryo develops. And again, fertilization can only occur when the sperm and the ovum meet. And there's a small window, about 24 to 36 hours, where that can occur after a woman ovulates. Fetus, fimbria, and FSH, which is follicle stimulating hormone. Fetus, stage in prenatal development from 8 to 39 weeks. Fimbria, finger or fringe-like projections at the end of the fallopian tubes. Follicle stimulating hormones secreted by the pituitary gland to stimulate maturation of the ovum. Here's gamete, genitalia, gestation. So gamete is the male or female sexual reproductive cell. That could be the sperm cell or the ovum. Genitalia means reproductive organs, also called the genitals. Gestation is the period from fertilization of the ovum to birth. And sometimes gestation period, that's why your due dates can be off a little bit, because you're just guesstimating when that can occur, because people don't remember the exact time when fertilization of the ovum took place. Gonad, gynecology, and human chorionic gonadotropin, HCG. So gonad is female or male reproductive organ that produces sex cells and hormones. 2 ovaries in the female and 2 testes in the male. Gynecology is a study of female reproductive organs, including the breasts. So you would go see your OB, obstetrician, or GN, OBGYN, gynecologist, right? Human chorionic gonadotropin, HCG, hormone produced by the placenta to sustain pregnancy by stimulating ovaries to produce estrogen and progesterone. The hymen, labia, lactiferous ducts. The hymen is a mucous membrane partially or completely covering the opening to the vagina. Sometimes if you play sports, that can definitely tear early. Labia are the lips of the vagina. Lactiferous ducts are the tubes that carry milk within the breast. Luteinizing hormones LH, mammillary papillae, and menarche. Luteinizing hormone LH is secreted by the pituitary gland to promote ovulation. The mammary papillae is the nipple of the breast. Menarche is beginning of the first menstrual period and ability to reproduce. Menopause, menstruation, myometrium, and neonatology. Again, menopause is gradual ending of menstruation. Menstruation is the monthly shedding of the uterine lining. The myometrium is the muscle layer of the uterus that sometimes can cause cramping. Neonatology is the branch of medicine that studies the disorders and care of the newborn, which is the neonate. Obstetrics, orifice, ovarian follicle. Obstetrics, the branch of medicine concerned with pregnancy and childbirth. Again, that's OB. Orifice is an opening. Ovarian follicle is developing sac enclosing each ovum within the ovary. Ovary, ovulation, and ovum. Ovary, one of a pair of female organs on each side of the pelvis, almond shape, produced egg cells and hormones. Ovulation is the release of the ovum from the ovary, and the ovum is the mature egg cell. So make sure you know the difference between ovary, ovulation, and ovum. They sound the same, but they're not, especially ovary and ovum. Okay. Parturition, perineum, pituitary gland. Parturition. Usually if you see the word shun, the emphasis will be on the syllable right before the shun. So parturition, micturition, urination. Parturition, act of giving birth. Perineum is the area between the anus, the vagina, and the females. Pituitary gland, endocrine gland at the base of the brain that produces hormones to stimulate ovaries, also regulates other endocrine organs. It's found in the sella turcica of the sphenoid bone. Placenta, pregnancy, and progesterone. placenta is a vascular organ attached to the uterine wall during pregnancy, allows exchange of oxygen, nutrients, and fetal waste products between the mother and the fetus. Pregnancy is a condition of having a developing embryo and fetus in a normal uterus for about 40 weeks, so 9 months. Progesterone, hormone produced by the corpus luteum and ovary and placenta of pregnant women. And you can have progesterone-only birth control as well. Puberty, uterine serosa, and uterus. Puberty is the point in life at which sex characteristics appear and gametes are produced, so male and females go through puberty. Perimetrium is the outermost layer surrounding the uterus. The uterus is the hollow pear-shaped muscular female organ in which the embryo and fetus develop and from which menstruation occurs. Again, the difference between an embryo and fetus is for the first 63 days it's considered an embryo. After 63 days it's considered a fetus. Vagina, vulva, and the zygote. The vagina is the muscular mucosa lining canal extending from the uterus to the exterior of the body. The vulva is the external female genitalia, includes the labia, hymen, clitoris, and vaginal orifice. And the zygote is the stage in prenatal development from fertilization and implantation to 2 weeks. Then it becomes the embryo. Pop quiz: which term refers to the inner mucous membrane lining of the uterus? And that would be A as in apple, endometrium.